So endocrine systemത്തിൽ നിന്നുള്ള questions ആണ്. So നിങ്ങൾക്ക് sorry. Yeah, this is the question. ഈ question വായിക്കൂ. Which of the following conditions may develop in females due to an increase in the production of which of the following hormones? So ഇവിടെ condition ഏതാ ഈ ഇമേജിൽ കാണുന്ന condition ഏതാ?
Hirsutism.
Yeah, this is hirsutism. So hirsutism is because of what? അതാണ് question. Hirsutism ഉണ്ടാവുന്നത് ഏത് ഹോർമോണിന്റെ വ്യത്യാസം കൊണ്ടാണ്? Yes.
Growth.
Hirsutism is excessive hair growth on the face, right? It is basically expected in Cushing syndrome. Cushing syndrome il hirsutism varam. Okay. Yes. Appo idinathe edu hormone inde variation kondana ingane oru problem undavunathu. Androgen aano, progesterone aano, estrogen aano, growth hormone aano. So idila edu hormone inde vyathyasam kondana hirsutism undavunathu. Yeah. So hirsutism, the hair growth is considered as a secondary sex characteristic basically in males, right? Yeah, so it is because of which hormone? You can remove wrong answers. It's not because of growth hormone, so you can remove that. And estrogen basically it's a female hormone, so namukku kalayam. So secondary sex characteristic is responsible hormone. The hormone which is responsible for secondary sex characteristic is androgen. So this is because of androgen. Okay. Hirsutism is expected in which condition? Either condition la hirsutism ettom koodalayitte expect cheyyunnathu? It is in Cushing syndrome. What is Cushing syndrome? What is Cushing syndrome? Yes. Cushing syndrome. Are you? Yes, anyone? Yes.
Corticosteroid hormones.
Corticosteroid hormones. Corticosteroids hormones endu vettumbozha? Corticosteroids hormones increased ആവുമ്പോ വരുന്നതാണ് basically Cushing syndrome. So glucocorticoid increased out. The production of glucocorticoid is increased in Cushing syndrome. Okay. So have you heard about Cushing triad? Yes. Cushing triad കേട്ടിട്ടുണ്ടോ? Yes. Have you heard about Cushing triad? Cushing triad. Yes. പറയൂ.
Moon phase.
Yeah. Remember, Cushing triad is not a sign related with the Cushing syndrome.
Okay, ma'am.
Cushing triad is not having any kind of relation with the Cushing syndrome. Cushing triad is early sign of increased ICP. Okay.
BP udundakana ma'am.
Yes. The systolic BP variation, widened pulse pressure undava, bradycardia undava, and then bradypnea undava. Irregular respiration. So you can write Cushing triad. It is a sign in increased ICP. Okay, increased ICP le varuna signs. You can just make a triangle. Oru triangle varichittu aa triangle de oru portion le bradypnea, bradycardia and widened pulse pressure. Widened pulse pressure is because of widened pulse pressure. What is pulse pressure? Difference between systolic BP and diastolic. Systolic and diastolic into difference. So 120/80. What is pulse pressure? 120/80 pulse pressure 40 alle. Okay, so pulse pressure increased down. Widened pulse pressure, it's because of increase of systolic BP, where the diastolic BP remains same. മനസ്സിലായോ? Systolic BP always increases, but diastolic BP remains the same. Okay. Clear are you? Fine. So what is Cushing syndrome? Excessive glucocorticoid or cortisol or cortisol. Glucocorticoid increased avunna condition aana Cushing syndrome. What is Cushing triad? It It is not having any relationship with the Cushing syndrome. Cushing triad is an early sign of increased ICP. There are 3 signs. 3 signs are one, BP, heart rate korayunu, respiratory rate korayunu. I repeat, heart rate and respiratory rate is reduced and BP is increased. BP increased, there is a peculiarity in hypertension. Only systolic hypertension is expected, but diastolic remains the same. Manslayo. So as a result of only increase of systolic blood pressure, where the diastolic remains same, it always widen the pulse pressure. What is pulse pressure? Difference between systolic BP and diastolic BP. Okay. Okay. What is pulse deficit? Pulse deficit kettittundo? Pulse pressure and pulse deficit. Yes. Pulse deficit in the it's a difference between or the difference between apical pulse and radial pulse. Okay. ഇവിടെ നമ്മൾ pulse pressure and pulse deficit. Pulse pressure difference between systolic BP and diastolic BP. Pulse deficit is difference between apical pulse and radial pulse. Okay. So this is the first question. So here the answer for this question is androgen. Okay. Next question. The client is receiving long-term treatment with a high dose of corticosteroid. Which of the following would the nurse expect the client to exhibit? Okay, steroids, long-term steroid therapy എടുക്കുന്ന ഒരു പേഷ്യന്റിന് ഈ പറഞ്ഞിരിക്കുന്നതിനകത്ത് ഏതാണ് expect ചെയ്യുന്നത്? Okay, so which sign is expected of a client who is receiving high dose of corticosteroid? So corticosteroid can cause what? Yes. Long-term corticosteroid can cause signs of Cushing syndrome, right? Okay, so what are Cushing syndrome and the signs?
Moon face.
Buffalo hump.
Truncal obesity.
Obesity. And what about the extremities? Extremities will be? Extremities very thin. Yeah, extremities will be thin. Yeah, very good. Okay, fine. Next. So what is the answer? I'm sorry. Did the answer is
Moon face.
Face is the answer. Okay, fine. Okay. Yes. Next question. While assessing a client with a hypoparathyroidism, the nurse taps the client's facial nerve and observe twitching of the mouth. Clear? And tightening of the jaw. Appa jawilum അതുപോലെ നമ്മളുടെ facial muscles-ലും ഒരു twitching ഉണ്ടായിരിക്കുക. So nurse would document this finding as which of the following? Okay. So it's a positive Trosi sign, Shostak sign, tetany, and hyperactive deep tendon reflex. What is this indicating? Shostak sign. So the answer is second one. So what is first option?
Positive
Trosi sign. What is that?
BP
cuff inflate ചെയ്യുമ്പോൾ yes. BP cuff inflate ചെയ്യുമ്പോൾ പേഷ്യന്റിന്റെ ഹാൻഡിൽ ഉണ്ടാവുന്ന ഒരു സ്പാസത്തിനെയാണ് so positive Trosi sign and positive Shostak sign. First one and A and B both are indicating hypocalcemia. Okay. And what is
Hypocalcemia.
Tetany is also expected as a result of
Hypocalcemia.
Perfect. So this is also expected as a result of hypocalcemia. And basically tetany, all over body, the muscles get twitching. Fine. So hypocalcemia even causes tetany. What is overt tetany? OVERT tetany. Overt tetany. What is overt tetany? Overt tetany, it is again a complication of hypocalcemia. What happens in overt tetany, you know, extreme hypocalcemia can cause a respiratory muscle spasm and it can cause respiratory arrest. So it can cause laryngospasm and bronchospasm and respiratory arrest can be expected. Fine. So that is expected in overt, O-V-E-R-T, overt tetany, characterized by respiratory spasm and laryngospasm. Fine. Okay, fine. Next. Which of the following clinical manifestation of type 2 diabetes occur if glucose level are very high? ഈ പറഞ്ഞിരിക്കുന്നതിനകത്ത് ഏത് ക്ലിനിക്കൽ മാനിഫെസ്റ്റേഷൻ ആണ് ഗ്ലൂക്കോസ് ലെവൽ കൂടിയാൽ ഹൈപ്പർഗ്ലൈസീമി കൂടിയാലല്ലേ യെസ് ഹൈപ്പർഗ്ലൈസീമിയയുടെ സൈൻ ആയിട്ട് കൺസിഡർ ചെയ്യുന്നത് എന്നാണ് ക്വസ്റ്റ്യൻ. Hyperglycemia. What is hyperglycemia? Increased sugar level. Okay, so that is considered as a hyperglycemia. So in hyperglycemia, which of the following signs are indicating or which is relating or connecting with the hyperglycemia? I'm sorry.
Blood vision.
Yeah, it is blurred vision. Okay, so blurred vision can be a sign of hypoglycemia as well as hyperglycemia. Okay, tell me what is hyperglycemia? It is increased glucose level. Okay, increased glucose level can be expected as a sign of diabetes. And there are certain medications are also causing hyperglycemia. Which medicine cause hyperglycemia?
Steroids.
Steroid. Corticosteroid increases the sugar level. Okay, very good. Very good.